Morning, morning. Okay, and hopefully on Friday I sent out the recorded video um, from next term. I'll answer this real quick. Michaela, I don't, usually large animal 2 is where you go to the farm. Large animal 1, I believe, is lecture. So yeah, it should be large animal 2 where the skills, most of the skills are. Okay, since I left off, I wanted to stress a little bit about this, about and hopefully you guys are able to see when you're looking at the PowerPoint at home, the notes pages, and I believe it shows underneath. But dilated cardiomyopathy, so dilated cardiomyopathy is more common in dogs. Hypertrophic cardiomyopathy is more common in cats. But some cats can get a dilated form. And it was more seen in the 1980s, but what they were figuring out is that it was more of a taurine deficiency, not as much as of a genetic component, but then they started adding taurine to the diet and the cases started to drop. So it acts just like it does in dogs, similar symptoms, similar presentation, large heart on radiographs. Siamese, Abyssinians, and Burmese cats was what it was seen most in. Also, I will say Maine Coons tend to get the hypertrophic. These were the cats that tend to get the dilated. And one thing to, again, diet and these heart diseases, if the animal was not genetically predisposed and you change the diet, it will often reverse the heart disease. So if it was genetic and you change the diet, we would see no change. So typically these myopathies are not reversible. Once they happen, all you're doing is treating the symptoms. Those were the ACE inhibitors, improving contractility, adjusting vessel diameter with drugs. So, adjusting sodium in the diet. All we're going to do is whatever the symptom is, we're going to treat the symptom. And eventually, unfortunately, what happens is the symptoms will get worse over time. And like I said on Friday, depends on when we get the patient, how advanced they are in the heart disease, what their life, 6 months to 2 years. But 2 years would be a dog that hopefully we got really early, or a cat we saw really early, and we have time to medically intervene. Now, anything that affects cardiac output, so we've got anorexia, weakness, and depression. And again, heart disease often goes undetected in cats because weakness or lethargy, when your cat is sleeping all the time, it's hard to pick up on, are they more tired than normal? Where if a dog is very playful, going on walks, is more interactive, you're going to pick up on some of these signs. So that's why, unfortunately, sometimes these cats come in when it's very, very bad. It's not the fault of the owner. They just show signs differently due to their, heart disease is always going to be worse the more active the patient is. That's just fact. So the less active your animal is, but like I said, if you see a steady decline in activity, this has to be on the radar. Any kind of dyspnea, that's difficulty breathing or fast breathing. One thing is thromboembolism. Thrombo meaning clot, and embolism is where it gets stuck. So what I've talked about, like with my cat with the murmur, and he has a slightly enlarged atrium. Anytime there is abnormal blood flow in there, potentially a small thromboembolism or clot will form. If that clot leaves the heart, it can lodge in the lungs and cause sudden death. Or it can lodge, if you remember, the aorta splits at the femoral arteries. and it goes to the both back legs. So cats get this thromboembolic disease, and all of a sudden they cry out, they're screaming, they can't use one of their back legs. Sometimes both back legs are paralyzed. I don't think spinal, if I see a cat coming in screaming and it can't use both of its back legs, I'm thinking thromboembolism. I'm not thinking spinal cord back fracture. Now, how do we diagnose this? I try to feel the pulse in the back legs. If there's no pulse and the legs are cold, that's thromboembolism. If they come in and the legs are very warm and I can feel adequate pulses and they have equal blood pressure in both legs, it's potentially spinal cord or a back fracture. Does that make sense? So there's going to be clinical signs right off the bat. And obviously, if we hear a heart murmur on this cat, then we're going to pick up on that. Pre-renal azotemia, you would do some blood work because there is poor blood flow to the kidneys because they have poor cardiac output. You need blood flow to the kidneys to maintain urine production and kidney health. If there's poor blood flow, azotemia is an elevation in BUN or kidney enzymes. You might potentially pick that up. So radiographs, you're going to look again for that pleural effusion, enlarged heart. An echocardiogram is going to be the best. This is the ultrasound of the heart, and that's going to pick up the size of the size of the muscle. It's going to pick up the size of the chamber. And you can do an ECG. Again, ECGs are difficult in cats. But again, anytime a heart muscle is not healthy, dilated, thickened, that electrical activity may be disrupted or abnormal. You might pick up on an arrhythmia. And basically, pleural effusion. There's a note here. Make sure to analyze. If you take an x-ray, and I will say this over and over again, you take an x-ray and there is fluid, that doesn't tell me anything. Now, you might look at all the other clinical signs that you need to really take a needle. The doctor will go in, take a little bit of that fluid. What comes out is going to, that's what's going to tell us. And that's when you guys talked in ClinLab 4 about cytology of fluid. If it's a transudate, you should have learned transudate versus exudate. Transudates are the very like watery fluid, not a lot of cells. The way I remember transudate transfers from body cavities easily. Transudates transfer. If I'm an exudate, I'm gross, I should exit the body. Exudates are typically a lot of purulent fluid. You get a lot of pus, a lot of thickness, a lot of cells. So exudates are typically higher in cell count, purulent. Transudates are associated with heart disease because it's an imbalance of fluid in the body due to impaired circulation. So a modified transudate is what's seen. Again, treating this in cats, this is getting into the hypertrophic cardiomyopathy. It's going to depend on how severe, what are they presenting. Probably need to know what they're feeding. A nice thing is they can give you the name of the food. You can probably look up the label online and see what is the taurine, how much taurine is in the diet. Because if it's taurine insufficient or deficiency, we can supplement that. Furosemide is that diuretic that'll help pull the fluid off the lungs or off of the heart, improve this circulation. ACE inhibitors are going to work with the vessels, but a lot of times it's risky in these first couple weeks because depending on when they present, at any point they could die suddenly. Most of the time when they die suddenly, it's because of a thromboembolism. And again, in my cat, he has a thickened heart. His atria is enlarged. And because it's enlarged, it's prone to clotting. We do not use, in people, they will use, my brain is just went, like heparin therapy or medications to prevent clotting. So blood thinners, so to speak. We don't tend to do that a lot in animals. There's mixed reviews on its efficacy. So most of the time we treat the symptoms, hope we can get some relief that way. And the hypertrophic, and maybe we talked about this a little bit. There is high pressure in the atria. This is what happens. So a lot of times the left atrial enlargement is because the bottom is thick. 5 to 7 years old would be an average age, but you can see this as young as 6 months old. This is the disease we talked about, the overrepresented in males, sometimes sudden death during anesthesia in male cats. They are prone, the big thing is prone to thromboembolism, and that's getting that clot out of the heart. Maine Coons tend to be a high breed that this happens, and anything mixed with a Maine Coon. The problem is most cat breeds, people will own cat breeds, but most of them are mixed breeds. Domestic medium, short, domestic long hairs. Whether there's some Maine Coon in that lineage can predispose them. Can be seen in neutered males, but it can also be seen, they're there to be neutered. So tends to be a murmur. You have some pulmonary hypertension. So because of the pressure on the heart, it increases the blood pressure in the pulmonary veins. That will increase fluid into the lungs. And so sometimes we get the pulmonary edema, we get the murmur, can put them into acute heart failure, or we see the embolism. Now, sometimes it is hard to hear the heart. Well, first of all, it's cat. Usually the heart rate's a little bit faster. If there's any breathing difficulty along with the cat, that's going to make it harder to hear the heart. And dogs are usually pretty good about, you can hold their muzzle if they're breathing hard and then listen to their heart. Cats don't tend to like to do that very much. One technique that you can do when you're trying to listen to a cat, if it's panting quite a bit, if it's purring, is I'll sometimes take a little bit of alcohol, just get rubbing alcohol and dab it on their nose. And sometimes it's enough for them to go, they kind of smell it, and for a moment or two, they stop purring. I did that once to a cat, and it massively started drooling buckets. I think I used a little too much, or the alcohol was very strong. And the owner was like, why is my cat all wet? Why is there drool? And I felt really bad. Most of the time, if you just put a little bit on a cotton ball, or just put your finger, get some alcohol and dab it on their nose, sometimes it's enough to, usually they don't sniff as hard as dogs do. Usually they just kind of wiggle their nose. They're kind of like, it shouldn't induce a lot of sneezing or a lot of, most of the time they'll pause for a minute. Sometimes you can kind of rub their throat a little bit, and they kind of, and it stops them. So dyspnea, you can get some pulmonary edema in later stages. A lot of times these guys have weak femoral pulses, which sometimes it's hard to feel femoral pulses in a cat anyway. What I try to do is I always try to feel both. I take my hands under both back legs, and I try to, the higher up you can feel in the groin, sometimes people feel really low on the back leg. The femoral artery kind of narrows. So if you can get up under their back legs, up into the abdomen, the higher sometimes you feel, the better you can feel a femoral pulse. But that's a way to compare right versus left. Are they both feeling weak? And then obviously if we're in the late stages and they present with this embolism, they're going to get acute paralysis. And when I'm saying they were fine 1 minute, the next minute they can't use their back legs. And it's extremely painful, but they are cold and you cannot feel a femoral pulse. So you're searching because the clot is blocking the arterial flow to the femoral artery. And You may pick up on some arrhythmias. X-rays are always one of the first things we do if we suspect heart disease, to see if there's any change in the heart position. It might be more of a Valentine heart. Again, a heart doesn't typically have that typical Valentine heart. It's a little bit more rounded, but it may have that, may come to more of a point. The problem is, especially in cats, radiographs aren't the gold standard as far as the test, but it's going to pick up an pulmonary edema or pleural effusion. And there are cats sometimes that don't show clinical signs. This way, sometimes it's a silent killer, unfortunately, is that it's hard to pick up arrhythmias in cats. We don't traditionally do a lot of EKGs in cats, so we don't find them till they're bad. Always in any of these heart muscle diseases, echocardiogram is the test of choice, and you're going to find that thickened heart muscle. Okay, the ultrasound always is going to measure the thickness of the heart, and that is the diagnosis. If it's overly thick, and in the ultrasound machine, what's interesting is you will type in feline, you're going to type in the age, and then when the doctor measures, they have formulas built into the ultrasound machine that are going to tell us, is this the normal ventricular muscle size for a cat? And again, the left ventricle is automatically thicker than the right because it's pumping to the rest of the body, but it shouldn't be overly thick. It's going to be thicker. So the doctor in the ultrasound will say, you know, is this left ventricle, is this right ventricle? And it'll calculate, the machine will calculate for the doctor. You're going to see hypertrophy, ventricular lumen. Lumen is an opening, like a vein. The opening here, that's the lumen. Okay, so within, that's the chamber. So the left ventricular chamber size, the ultrasound is also going to measure. And it's going to be smaller because the muscle is taking up the chamber. Okay, so thickened muscle, decreased, and these are important things I want you to know. It's perfect things to ask for a test. In dilated cardiomyopathy, the chamber is enlarged. In hypertrophic cardiomyopathy, the chamber is decreased. Okay, so that's the difference in those two. Sometimes it has trouble. They always measure outflow. So how much blood is going out of the heart could be decreased because of the thickness of the papillary muscles and the thickness of the chambers. It affects the flow. And sometimes during ultrasound, they can see the clot floating. You'll take an ultrasound and you'll see this piece, and then we can actively see a thrombus. Now those, if you see a thrombus during an ultrasound, that animal has a much poorer prognosis because that can dislodge at any time. And again, we do not use a lot of anti-clotting medications. They just don't have as much success as they do in people. So treating, again, symptoms, beta blockers, and what this does, decreases myocardial oxygen demand, decreases heart rate. If we know there is an active thromboembolism, we have to be cautious in cats. There is a potential to try aspirin therapy, although again, in cats, now acetaminophen, Tylenol is acetaminophen, we never use that in cats. We never would use Advil. We have Onsior that we could use potentially, but aspirin, you have to weigh the risk versus benefit. But again, the treatment is to slow the heart rate down. And I cannot tell you how important this is when I get into anesthesia next term with you guys. I'm going to talk about myocardial oxygen demand, because heart rate, monitoring heart rate during anesthesia is important, because the faster the heart rate, the harder the muscle is working, the more oxygen it needs. So in these guys, you have a thickened muscle. The thicker it is, the harder it is to oxygenate it. But if we make the heart slow down with a beta blocker, then what happens is the heart isn't pumping as hard, oxygen demand for the heart will go down, and hopefully will help in this situation. So you will hear me say myocardial oxygen consumption probably more than you ever want me to, but it is key, and a lot of problems come when we have impaired myocardial oxygen consumption. The prognosis is it's very dependent on when we see the patient. Multiple causes, like I said, if it was diet related, that's better. If it was just they were feeding a diet that was extremely low in taurine, if they were feeding grain-free, there's some dietary component to this, but like if it's a Maine Coon, that's probably a genetic cause and is probably not a diet cause. So it depends. Diagnosis, 1 day to 6 years. That's kind of a very wide, doesn't give our owners a good idea. So some research, median survival, 92 days, which is, roughly 3 months. And again, cats with a resting heart rate less than 200 live longer than cats with a heart rate of greater than 200. 5-Minute Consult is a book. DVMs can get it. You can look up diseases, and it's quick little blurbs about diseases. So that was that source. But again, the higher the heart rate, the harder the heart is working. So you're going to have cats that come in. Most cats present with a heart rate of 180 to 220, an average cat. I would usually see these really cool chill cats that would come in, and they sometimes had heart rates between like 140 and 180. They're kind of chill. That's not your average cat, but if you have a cat that has a naturally lower heart rate, that heart works less hard, it's better for the cat. So you can see this is all over the place. The veterinarian is going to have to give the owner some type of guideline as far as prognosis. To just kind of back up on the problem that we're having is a thromboembolism, which is basically aggregation of blood. So the clotting factors in the blood, if they aggregate or come together, you have platelets, fibrin, cellular elements. It all kind of makes this clot. But the problem is it's going to create it's going to leave and create an obstruction of blood flow. So basically a thromboembulus is when we have this thrombotic material leave its location and get transported to an area and cause a blockage. And again, we have, platelets, or we have areas in the body that this tends to happen to. If it comes loose through the aorta, it's typically, remember, the aorta is going to the tissues. So that clot is going to find a place to get stuck. Wherever it blocks the blood flow, it can also impair blood flow. If it lodges and it doesn't cause a complete obstruction, it's still not allowing that area to get normal blood flow. So typically, again, 10 to 20% of cats with this HCM will develop some type of embolism in the left side of the heart. And cats tend to have high platelet activity. It means their platelets are more likely to clot than a dog's. So a cat already has a higher likelihood of forming a clot. And then if they leave, the most common location that it goes is basically, it's called the distal aortic trifurcation instead of bifurcation, trifurcation. But, okay, you're going to have an aorta, you're going to have the femoral arteries, and you're going to have an accessory branch that's going to feed the tissues and the muscles. If it gets stuck at the trifurcation, none of those vessels get oxygenated blood. This is the back legs, and this is the muscles and other tissues associated with the rear. This is the rear of the animal. So if I ask you what a saddle thrombus is, that's the common term used for a clot in this location. Now, a saddle thrombus is usually talking about the hind limbs in general. So the presenting sign is a suddenly paralyzed cat in the rear end. And again, these guys are it's very dangerous holding these cats when they come in because they're usually flailing, screaming. They're acutely painful. It's very painful. There is acute onset of paresis if they have like pink pads. So if it's like a white cat or an orange cat, you'll actually see they look blue. Okay, sometimes you can't see the color in their paw pads, but if they have little pink pads, they will appear blue and cold, and you cannot feel palpable pulses. You cannot feel femoral pulses. Typically, there's some kind of dyspnea, tachypnea, murmur. Usually, that's why when they're paralyzed and you listen to their heart, if they have a murmur, it's probably not a spinal cord injury. It's probably a thromboembolism. And it's overrepresented in male cats, almost 2 to 1. Dogs have a much larger, that trifurcation, that aortic trifurcation is larger. So they're not as prone to they're not as prone to getting the clots as cats are. When we typically see them, CK is not a test that's commonly done. This is our creatinine kinase test, which is sometimes done, and that test involves the muscles and kind of like muscle health. If a chemistry panel had that, then that would be an issue that you might see. And then if you have your ALT and AST, that's liver. Typically they're elevated, blood glucose, BU, and creatinine. Because the blood flow in these animals is compromised, and maybe has been compromised for quite a while, sometimes the liver and kidney enzymes are elevated due to improper blood flow due to their cardiac circulation. Usually their CBC doesn't show any issues. Doesn't usually affect that. Most of the time, if they're going to have an enlarged heart, and a lot of times if you do the echo, you're going to do or feel, you're going to see that HCM. You're going to see the thickened muscle, decreased chamber size. What do we do for treatment? So most of the time, depending on when you get these guys, they are going to have to stay in the hospital. This isn't give them a pill, go home, let me know how they're doing. We have to decrease their stress. We usually sometimes put them in an oxygen cage, padded cage, and a lot of times anorexia because they're painful, or because they, if this disease is progressing, they're maybe not eating well. This is when we give them whatever they want. At our clinic, you obviously have very good clinic foods, the super high nutritious. We always kept a box of Friskies in our clinic. And it's kind of like McDonald's for cats or junk food. Are we really supposed to be eating all this fast food crap? No, but every once in a while, someone's like, I don't want that healthy stuff. Oh yeah, give me a cheeseburger. Okay. So kind of like Friskies, we'll have these cats that aren't eating. And of course we want them to eat the very good nutritious food. But every once in a while, you're like, just give me a good old can of Friskies, the junkiest food we have. Maybe the cat will eat that. So you do have that ability. Typically, the main anticoagulant we use is heparin. And I don't know if you've talked about heparin, but heparin is an anticoagulant. A lot of times we add a little bit of heparin to a bag of regular saline. And when we flush IV catheters, we flush with something called heparinized saline. Now the heparin in heparinized saline, like if you've worked at a clinic and you have sometimes these syringes laying around, it's a very, 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 very small amount of heparin. It's just to prevent catheters from clotting while they're hospitalized. Um, a lot of times when we're using heparin for this treatment, we're going to use higher amounts of heparin. It's not really breaking down the clot that is stuck, but it's preventing clotting from getting worse. So we're trying to prevent the coagulation cascade. Warfarin is another anticoagulant we can use, and potentially aspirin. The progress is extreme, or the prognosis is extremely poor. Many are not going to recover, and many will throw another clot. I will tell you briefly, I normally when these cats come in, I'm like, please euthanize them. They are screaming, they are painful. I have very rarely treated a cat inpatient with thromboembolism. Now, I had a cat when I was at Northwood. Older couple came in, and the cat gets rushed in the back, male cat, screaming. One back leg was more affected than the other. So we think one back leg had a moderate pulse. We couldn't feel another pulse in the other back leg. And when they went in the room initially, they were like, they want to treat this cat. And I was like, are they crazy? Like, this cat is not going to do well, blah, 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 blah. I go in the exam room, and the owner had old couple, sweet man and woman, been married forever. The man had been suffering from colon cancer. And the priest, there was a priest that went to visit him in his home. And when he opened the door, this cat ran in. And so he opened the door and he let the cat in, and the cat immediately went to the male owner and jumped on the bed and laid with him. And the owner was like, where did this cat come from? And the priest said, well, he was sitting at your door. I figured he was your cat. And he goes, we don't have a cat. But this cat would not leave this male owner's side. And he basically helped him get through chemotherapy and recover from colon cancer. I came walking out of that room after going over the estimate with them, practically bawling, going, we are going to do everything to save this cat. It completely flipped my mind, because the owner, this wasn't even their cat initially, but he was like, this cat got me through cancer. I want to do everything I can to treat this cat. So we basically put in a catheter, started heparin therapy. The leg, one leg improved. The other leg ended up turning into almost like a wooden stump. It was the oddest thing. I've got pictures of this cat. I'm going to try to load it. This cat, we ended up doing an amputation on the leg that never recovered. So now we had a 3-legged cat that was on medication for his heart because he had HCM. That's why he got the clot. So he was on heart medication. He recovered from an amputation. He eventually started having an elevation in his kidney enzymes, and he stopped eating. So we put in a feeding tube. So now I have a 3-legged cat, heart disease, feeding tube. Eventually his kidney enzymes improved, and he started eating on his own. He had the feeding tube for about 2 to 3 months. And then unfortunately, the owners started getting sick again. These owners were like one of my favorite clients. They always asked for me. I changed the tube. I changed the bandage on the cat. I taught them how to tube feed. I cleaned the amputation site. I did the anesthesia for his amputation. So they brought me pies for Christmas. They brought me gifts. We would sit and chat. Unfortunately, the owner ended up having a relapse of colon cancer and dying, and the cat died shortly afterwards. It was I don't know. Is anybody crying right now? I feel like I had to tell that story, but, or people have just muted me because they're like, what the hell is she talking about? But, you know, it's very rare in that case to treat these cats. It's very rare to get a certain outcome. And this was an actual really good scenario that happened. So I will try. I might on Facebook share a picture of this kitty on the page. But, you know, the problem is that heart, once they've thrown one clot, the likelihood that they could throw a second clot. This cat never did, but they were willing to do tube feedings because of the anorexia. They did sub-Q fluids. I taught them how to do that, you know, and watch for what to look for. If, you know, they would bring him back in for blood work. So they were very good to do all this treatment because of the owner. Okay. So does anybody have any questions as far as the difference? I unmuted everybody for a second. So keys here that I want you to take away from the heart disease lecture is big clinical signs that owners would notice. Differences between the two, obviously dilated versus hypertrophic. And the consequence of any disease is that the heart's job is to pump blood out of it. And anything that affects the blood's ability to pump to the body, and what is the consequence of that if the heart cannot do it? Dilated, it doesn't have enough strength. That's the issue. Hypertrophic, it doesn't have enough capacity in the ventricle, so you don't pump out as much. So there's really consequences to both sides that affect the heart's ability to do its job. And again, I know you guys really covered arrhythmias more in Animal Tech 4, so I'm not getting deep into. You've already kind of